Have you ever heard of forced labor? So forced labor is the colloquial term for what is medically referred to as induction of labor. And in this video, we will dive deep into exactly what this is. Stay tuned. So first we'll start with what induction of labor is not. Induction of labor does not happen when a health professional or your OBGYN is tired of seeing you pregnant and thinks, let's get this baby out as soon as possible. Neither does it happen when you have a holiday coming next month and you just want the baby to be delivered as soon as possible. I had many experiences with my patients when I told them about induction of labor, that is what we wanted to do, that they would initially tell me no, they did not want it done and they wanted to go home. So we thought it would be necessary to create this video on induction of labor to allow you to understand more deeply what this is, so that next time you find yourself in this position, you are more and better informed. Okay, so what it is essentially is what we're trying to do is we're trying to take a pregnant woman who is not in labor. Remember, labor is a progressive and regular contraction that is resulting in a cervical opening and thinning. We want her to go into a state of non-labor into a state of labor, right? And we use artificial means. So ideally, every woman should go into labor spontaneously. But there are actual methods that we are able to use that allow a pregnant woman to go into labor. So now we'll talk about some of the reasons or indications for induction of labor. And by no means is this list exhaustive. But what we're trying to say is to give you basically an overview, a general idea of some of the reasons that could lead you to be induced. So the reasons leaning towards the benefit of the mother and reasons leaning towards the benefit of the infant, right? So some reasons why a mother would be induced, which are more maternal. For example, if she is having pre-existing medical illnesses. For example, she's hypertensive, she's diabetic, or epileptic. And in that case, during her pregnancy, we see that there's a point that her current medication is not sufficient, right? And if she starts to have uncontrolled blood pressures, if she starts to fit uncontrollably, if she starts to have sugars which are all over the place, right, and has reached term, at that point, your medical practitioner would decide that it would be more beneficial to have the baby delivered as soon as possible. Other reasons could be more obstetric. For example, conditions like preeclampsia, eclampsia, which we can discuss in videos to come. Other conditions like placenta abruptio, when part of the placenta detaches from the uteral wall. Right, so those reasons would be, well, placenta abruptio actually could be for both, right? If the baby at that point begins to show signs of distress, right? In that case, it would be advisable to have the baby out as soon as possible, right? Okay. So other reasons that the baby could be delivered as soon as possible, for example, would be in conditions where we see that there are fetal anomalies, for example. In that case, there will be no benefit. For example, if a condition which is incompatible with life, there will be no benefit of having that pregnancy go all the way to term when it is already discovered that this baby is incompatible with life. Other conditions, for example, are if there is intrauterine death, right? If, unfortunately, the baby dies in utero. At that point, induction of labor also could be necessitated. Again, this is not an exhaustive list, but this is just giving a general overview for some reasons why you could be induced the next time that you find yourself in a labor ward. I now discuss the methods of induction of labor. So the method that will be used will be chosen based on how many pregnancies you've had previously. We're saying that a woman who has had no pregnancies in the past will be different from a woman who has had many previous pregnancies, yeah? So your OBGYN will essentially, first of all, assess with a vaginal examination to see just how far along you are. If you are in labor, if your cervix is completely closed or it is slightly open. Another thing that will be done is your baby, the condition of your baby will be assessed meaning we want to hear the fetal heart and know just how well the baby is. So this could be done with a fetoscope, where it will be placed on your abdomen and the heart rate would be counted, or a CTG will be done, a CTG which is a cardiotocography. And that can also be done just depending on the facility that you're at and what is available there. So the methods used, we'll divide them into medical and mechanical, right? So the medical, we're saying that medication is used, that tablets are used. And these tablets normally are inserted into the vagina, and you will be assessed periodically with vaginal exams. And each time your OBGYN will decide whether you will need more or less, let's say that. And then the mechanical methods, first one will be a membrane sweep, right? This is done usually during a vaginal examination, where the amniotic bag, the sac which holds the baby, is simply pushed away and separated from the uteral wall. And this is all done with the fingers. The other thing that could be done is an artificial rupture of membrane. So this is where an amnio hook will be used. We'll just show a picture somewhere. And what will be done, again, a vaginal exam will be done, and this hook will be used to more or less puncture that bag and allow that amniotic fluid to escape. And after that, most likely, you'll be taken to the labor ward and oxytocin will be used. This is a drug which is used to induce contractions. Another thing that could be used is a balloon catheter. We'll insert a picture, most likely. And this, again, is dependent on whether your cervix is slightly open. So it is most of the time open in women who have previously delivered. And in this instance, a balloon catheter is pushed into the vagina and pushed into the cervix and inflated with fluid, and we wait for it to fall. So this might sound a little bit complicated, but going forward we can explain further. Nevertheless, I hope at this point you are a little bit more informed on what induction of labor is, on what forced labor is. And next time your OBGYN tells you that you will be induced, you'll have a little bit more power, and you'll know and you'll be more informed on what this is, and you will be more comfortable with the procedure. So, thank you for watching the video. So be part of the healthy family by subscribing to the channel. Comment down below if you have any suggestions, and if you just want to ask us any questions on what has been discussed. And don't forget to share and like the video. It gives us a lot of support. See you next time.